Sinus is a very common complaint with which the patients present to us. When they say that they have a sinus problem, they actually attribute the term sinus to a lot of complaints pertaining to their nose and the sinuses. And this may be due to allergies, it may be due to nasal blockage, it may be headaches and several other complaints. Sinuses are actually air pockets around the nose. You see around the nose, this is the nose, we have several air pockets. We have them in the forehead, we have them under the cheek, we have them between the eyes, and we have one large one in the center of the head, which is about 10 centimeters or so from the outer part of the nose. These sinuses are air pockets. Basically, by default they contain air, and they open by very narrow openings inside the nasal cavity. So, literally they are an extension of the nose into the skull. The one that you see here in the forehead is called the frontal sinus, and this purple one that you see here in the cheekbone is called the maxillary sinus, and these sinuses those are between the eyes, these green ones, they are the ethmoid sinuses, whereas this is the sphenoid sinus, which is located deep behind the nose, and it is called the sphenoid sinuses. So, strictly speaking, these are air pockets around the nose. Acute sinusitis is actually inflammation or infection of the maxillary sinuses, and can affect any sinuses, but most commonly it affects the maxillary sinus. It is actually a sequelae to a common cold or a viral flu that can complicate into patients developing acute sinusitis, but strictly speaking, it is inflammation and infection of the lining of the sinuses, which is called acute sinusitis. Common flu is caused by viruses, and particularly by the influenza virus, and usually all sinusitis will start off as a viral infection or a common flu, and when this common flu persists more than 5 days or continues for more than 10 days, that becomes acute sinusitis. Treatment for acute sinusitis depends whether it is mild, moderate or severe. For mild cases, we will generally give supportive treatment, and supportive treatment will be in form of decongestants mainly, and maybe saline irrigations, and if they have allergies, then we can give them some antihistamines, but generally the treatment is supportive. Whereas in moderate or severe cases of acute sinusitis, we will usually add intranasal steroids and will consider giving them a course of antibiotics. That is a good question, because you see, if you look at the sinuses, the neighboring structures in the sinuses here are the eyes and the brain, which is behind there, and infection from the sinuses can easily track inside the orbit or inside the eye and the brain. Now, if you look at this structure here, this is this wall that separates the eye from the sinuses inside the nose. This wall is called the lamina papyracea, which means that it is paper thin, and infection from the sinuses can easily track inside the orbit or inside the eye and cause serious consequences and even visual loss in sometimes. Similarly, the forehead sinus or the frontal sinus, if you look at it, is separated from the brain by a very thin wall as well, and infections of the frontal sinuses can track into the frontal lobe of the brain. Now, apart from direct spread of the infection from the sinuses, there are venous channels whereby the venous channels from the face and the sinuses communicate with the venous channels of the brain, and thereby infection can track inside the brain or inside the eye through these venous channels. And these complications can be serious and sometimes even life threatening. But in this current era of antibiotics, fortunately they are rare and we do not see them very often. Chronic sinusitis is very different from acute sinusitis. Whereas most cases of acute sinusitis are caused by an infection, infection has a very small role to play in chronic sinusitis. When sinusitis or symptoms of sinusitis persist more than 3 months or 12 weeks, we call it, we term it as chronic sinusitis. Chronic sinusitis is a multifactorial problem, and some experts refer to it as a syndrome, not as an infection, but as a syndrome. It can be caused by several things. It can be caused by allergies. It can be caused by anatomical problems inside the nasal cavity. It can be caused by structural problems. It can be caused by bacteria inside the nose, by biofilms, whereby the bacteria inside the nose develop colonies in the nose and the sinuses. It can also be caused by fungus. So, there are many factors. Immunodeficiency, when the patient is immunocompromised, can cause chronic sinusitis. So, you look at it, there are several factors that are responsible for causing chronic sinusitis. The treatment for chronic sinusitis would be to identify as many factors as possible that are causing the patient's symptoms, and treat them concurrently. For example, if it's just inflammation, then we treat the inflammation with the intranasal steroids or even oral steroids. And if there is an infection, then we'll treat it with antibiotics and with culture-directed antibiotics. And if there's allergies, we treat the allergies, and if there is a fungal infection, we'll treat the fungal infection. So, it is targeted towards the etiological factors than empirical treatment of chronic sinusitis. Yes, some cases of chronic sinusitis may require surgical intervention. This is when they develop complications of chronic sinusitis. That may be a mucocele formation, whereby the infection or inflammation or the pus begins to collect inside the sinuses, and the sinus starts to expand. That is called mucocele, and in that cases we will have to operate and open the sinus to drain the contents of the mucocele to marsupialize the sinus. The other situation will be to optimize the sinonasal cavity for deliverance of medication and for nasal irrigations. So yes, the surgery is sometimes necessary for chronic sinusitis.